The following segment is sponsored by Renown.
With 10 locations across northern Nevada, the team at Renown Urgent Care is available for care for you and your family 7 days a week. Joining us now is Dr. David Lemak, the Division Chief of Urgent Care at Renown. Dr. Lemak, thanks so much for joining us. What is available to people now when it comes to urgent care? A lot of options out there.
There are. The idea behind urgent care is to be available for all ages, for anything that's not something that can wait for a visit to the primary care provider or the pediatrician, but is not severe enough to need the emergency department.
So what types of conditions are we talking about? You know, bad ear infections, what are we talking about?
Sure. Sprains, strains, simple lacerations, allergy symptoms, pretty much anything that doesn't have the word severe in front of it.
Okay, not an emergency.
Correct.
Okay, all right. Are there certain instances when an individual should seek emergency care and not go to urgent care, just go straight to the ER?
Yes, again, to use that phrase, severe.
Okay.
If what you have is severe, probably not a good choice.
Okay.
You should be going to the emergency department. But also anything that would be considered, if one's concerned about whether this could be a stroke or is this a warning sign for a heart event, nope, the right place is the emergency department.
Okay, and they have the right equipment there to deal with that, those issues. Anything else that's important about going to an urgent care when it comes to making appointments, or how easy is it to get in? What's the best way to do that?
Well, first of all, through the website, you can access an ability to get essentially a place in line. There's always the opportunity for walk-in visits, but it's a little bit faster to do it through that placeholder kind of system.
Yeah.
But I'd also mention that virtual visits have become much more a mainstay of our practice. So there are a lot of conditions that if you have a rash or you have something fairly simple, it can be managed through a virtual visit from the comfort and safety of your own home.
And we've gotten a lot more comfortable with that over the last, last year or so with COVID, and that is a real great option, even when it comes to urgent care. So it's good to know.
Absolutely.
All right, David Lemak, thank you so much for joining us. And if you'd like more information, go to renown.org/wellbeingwednesday.